I'm Graham, and I'm responding to Jordan about their claim about amendment should be illegalize abortion, and pretty much what she was talking about is that their goal is to stop abortions because of physical and mental health issues, but the mental health that we really should be looking at is that if abortions are illegal, we should look at the child's mental health and physical health. The child that will be born into an unstable environment, and this will affect the child's mental health and future way more than the mother's memories of aborting the child. And from healthcare.com, children born to teen mothers suffer from higher rates of low birth weight and related health problems. The proportion of babies with low birth weights born to teens is 28% higher than the proportion for mothers aged 20 to 24. Low birth weight raises the probabilities of infant death, blindness, deafness, and chronic respiratory problems, mental health retardation, mental illness, and cerebral palsy. In addition, low birth weight doubles the chances that the child will later be diagnosed as having dyslexia, hyperactivity, or another disability. And so also, she also mentioned something about that abortions surgically are unsafe for the mother, but from World Health Organization, when performed under proper medical conditions by trained personnel in a hygienic setting, abortion is extremely safe procedure. Fewer than 1% of all U.S. abortion patients experience a major complication, and the risk of death associated with abortion is 10 times as low as the association with childbirth. So, yeah, and then also about more about their physical health is that for the teenagers who become mothers often have grim prospects for the future. They are much more likely to leave school, receive inadequate parental care, rely on public assistance to raise a child, and develop health problems, and that's from lawteacher.net. And then a little bit to more describe about the procedure of abortion is that a surgical abortion can usually take about 5 to 15 minutes. Although the woman's experiences with aspiration abortion may vary in time, many say that it is uncomfortable but bearable, and most women return to their daily activities the day after, and that's from National Abortion Federation. So, and then that's only after the 9-week period that you get a surgical abortion. And then for the oral pill, from a National Abortion Federation, medical abortion uses 2 medicines to end a pregnancy. The first is the first weakens the attachment of the pregnancy to the uterus. The second makes the uterus cramp and causes bleeding, which expels the pregnancy. So this is a lot just like a little bit more uncomfortable period and such and stuff. So. And then we should also, there's the disadvantages of creating an amendment that will legalize abortion are that women will now try to do illegal abortions, which create severe mental and physical injuries to the woman. From socialistworker.org, in 2006, an interview with a University of California Davis professor, Carol Jaffe, the administrator described women risking cardiac arrest by swallowing whole bottles of quinine pills along with castor oil, and women who douche with a variety of dangerous chemical products in an attempt to terminate the pregnancies. And then the women who have to keep the child will cause, if abortion is illegal, the women who have to keep the child will cause the child a lot of pain and suffering through its life because the mother never wanted the child in the first place, so the kid could be abused and not taken care of. So from life.org, a policy that makes contraception and abortion freely available will greatly reduce the number of unwanted children and thereby curb the tragic rise of child abuse in our country. Legal abortion will decrease the number of unwanted children, battered children, child abuse cases, and possibly subsequent delinquency, drug addiction, and a host of social ills believed to be associated with neglectful parenthood. And then Jordan also mentioned something about about marriage and stuff like that, and how it caused a lot of problems in marriage. But this plan is supposed to be the government is making this plan, so abortion is illegal. So the government really shouldn't be technically involved in people's day-to-day like marriage life stuff. And then also this plan is saying that abortion should be illegal. So, but we're saying it should be legal. And just because it's legal doesn't mean you actually have to get an abortion. So if you're against abortion and you don't want one, then you don't have to get one. So, and then also some other disadvantages is if the doctors told the parent that the unborn baby will be born with a horrible disease and will suffer throughout its life, and the parents don't want it to go through that, they can abort it and save it from its own pain. And then from healthguidance.org, technologies have been enabled disease detection amongst unborn babies. Giving life to an unhealthy baby and watching it suffer all day and night can be highly jeopardizing for the family as well as a newborn child. So the child could live through a horrible disease and life could live through a horrible life and stuff, and sometimes the parents want to abort it because they don't want to watch the baby suffer and have the baby suffer and stuff. So, yeah. And that concludes